This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today.
Welcome back to the 21st Century Man podcast. We're going chapter by chapter through this incredible book, The 21st Century Man. And today, we're diving deep, really deep into chapter 81.
Chapter 81.
Viagra and Beyond.
Oh, yeah.
It's written by Dr. Judson Brandeis.
Renowned urologist.
And he really takes us on a journey through the science and history behind treatments for, well, erectile dysfunction, starting with the arrival of the game changer, Viagra.
You know what's so fascinating to me about how Dr. Brandeis approaches this chapter? He doesn't just present it as a dry medical textbook overview.
Yeah.
He makes it a story of scientific discovery, and how sometimes these unexpected twists and turns in research lead to breakthroughs that have a massive impact on men's health.
And this is the great example of that, the story of Viagra's origin. Like, it wasn't even intended for what it ended up being famous for.
Right.
Like, Pfizer, back in the early 1990s, they were looking to develop a new medication for heart conditions. And their focus was on this enzyme called PDE5. They thought, okay, if we can block this enzyme, it'll improve blood flow to the heart. Makes sense.
Seems logical.
But here's the thing. The initial clinical trials, they weren't really showing the cardiovascular benefits they were hoping for.
It makes you wonder if they were about ready to just put it on the shelf, like, okay, this isn't panning out the way we thought.
Right. But then this is where Dr. Brandeis, he really paints this vivid picture in the book. There was this observant nurse during these clinical trials, and she started to notice something unusual. Several of the male participants, they were experiencing, erections as a side effect.
Wow. Talk about an unexpected finding. I mean, you have to wonder, if it wasn't for that nurse's keen eye, how long would it have taken for them to realize what they had stumbled upon?
It's a classic example of those serendipitous moments in science. You just never know where the next breakthrough is going to come from. And Pfizer, they deserve credit here. They recognize that, hey, this is something big.
Yeah.
Like Dr. Brandeis even emphasizes in the book, he puts it in all caps, huge E.
Huge, yeah.
They realized they might have a solution for a problem that, let's face it, a lot of men face. But, back then, it wasn't as openly discussed.
Right. Back then, it was hush-hush. Nobody wanted to talk about it. And the impact of Viagra, it's been undeniable, really. It was approved by the FDA for erectile dysfunction, ED, in 1998. And the book throws out this incredible statistic. Over 100 million men have used PDE5 inhibitors like Viagra and Cialis since then. I mean, that number, it's staggering. And I think that also speaks to the effectiveness of these treatments.
It's huge, yeah. And it also probably had a huge impact on just making it more okay to talk about men's sexual health.
Oh, absolutely. It really helped to destigmatize the whole conversation.
And Dr. Brandeis points out it wasn't just about a drug. Even the way we talk about this condition changed. Like back in 1993, the National Institutes of Health, the NIH, they launched this campaign, and they recognized that what was then called impotence, it was a major public health issue. They were the ones who started to shift the language towards erectile dysfunction.
And that change in terminology, it really was significant, wasn't it?
It feels like it made it less of a personal failing and more of a medical condition. It normalized it in a way.
Absolutely. It made it more approachable, less judgmental. And Dr. Brandeis also connects Viagra's approval to the 1998 Nobel Prize in Medicine, which was awarded to 3 researchers who did groundbreaking work on nitric oxide and how it plays a critical role in blood vessel function, including, guess what? Penile erections.
So Viagra, it wasn't just this random accident. It was built on this foundation of science. It was a result of years of research and understanding how erections actually happen at a molecular level.
Right.
So we have Viagra, and then Dr. Brandeis goes on to talk about the other PDE5 inhibitors that came on the scene, like Cialis, Levitra, and Stendra. And while they all work in a similar way, what were some of the key things that stood out to you about the differences between them?
Well, Dr. Brandeis does a great job of explaining that at their core, all PDE5 inhibitors are helping to maintain levels of this molecule called cyclic GMP in the smooth muscle tissue of the penis. You can think of cyclic GMP as the signal that tells the blood vessels in the penis to relax, to widen, which allows for the increased blood flow that you need for an erection when you're sexually stimulated.
It's like the green light for an erection.
Exactly. But where they differ is in how quickly they kick in, how long their effects last, and then there are some subtle variations in their specific side effect profiles and some other unique characteristics.
Oh, and one other important thing that Dr. Brandeis points out is that each of these medications, it has like a brand name,
Right.
like Viagra, but then there's also a generic name, which is Sildenafil in that case.
Exactly, yeah. It's important to know both because you might see them used interchangeably.
So let's break it down. Starting with Viagra, or Sildenafil, the OG, Dr. Brandeis writes that it typically starts working within about 30 minutes, and its effects can last for around 4 to 6 hours. He also mentions that some users have reported visual disturbances, like a temporary bluish tint to their vision.
Yeah, and that seems to be something that's a bit more common with sildenafil compared to some of the others, though it's usually temporary.
Thankfully.
Yeah.
Now, when it comes to dosage, Dr. Brandeis really emphasizes that the maximum dose for Viagra is 100 milligrams. And like he says, taking more than that won't necessarily make it more effective and is likely to increase the risk of side effects.
Right. Side effects like headaches, facial flushing, those visual changes we talked about, and even things like acid reflux. It's not worth pushing the dose beyond what's recommended.
So stick to the guidelines, folks. And he mentions that generic sildenafil, it often comes in 20 milligram tablets, which can give you more flexibility to adjust the dose, but of course, any changes should always be done in consultation with your doctor.
Absolutely. Always consult with your doctor before making any changes to your medications. It's crucial to get personalized advice.
Now, Dr. Brandeis, he throws in some really practical tips. Like, he advises taking Viagra on an empty stomach, or at least avoiding a heavy, high-fat meal right before, because that can slow down how quickly it gets absorbed. And there's that thing about grapefruit juice, too.
Oh, yeah, the grapefruit juice thing. It's interesting how certain foods and drinks can interact with medications.
So what's the deal with that?
Well, Dr. Brandeis explains that grapefruit juice can actually block an enzyme in your liver that's responsible for breaking down sildenafil.
So it stays in your system longer.
Right. And that means the levels of the drug in your bloodstream can get higher than intended. Now, for some guys, that might sound like a good thing.
Yeah, more bang for your buck.
But the downside is that it also increases the likelihood and the severity of those side effects.
So maybe not worth it.
Probably not. So moderation is key when it comes to grapefruit juice if you're taking sildenafil, or even better, just avoid it altogether around the time you're taking the medication.
Good advice. All right, so let's move on to Cialis, which is Tadalafil in its generic form. This is the one that's often called the weekend pill.
The weekend pill, yeah. And for good reason.
Because it lasts so much longer.
Exactly. Dr. Brandeis says Cialis can start working in about 20 minutes, which is actually a bit faster than Viagra for some guys.
Okay.
But the real kicker is that its effects can last for an impressive 24 to 36 hours.
Wow.
So you can see why it gets that nickname. The maximum dose is 20 milligrams, and because it hangs around in your system for longer, there's also a lower dose option, a 5 milligram daily dose.
So if you're looking for spontaneity, that daily dose could be a game changer. Dr. Brandeis does mention that similar to Viagra, it's generally a good idea to take Cialis on an empty stomach, but he points out that food doesn't seem to affect its absorption as much.
Right, and one unique side effect he mentions with Cialis is muscle aches.
Oh yeah, that's interesting.
Not everyone experiences it, but it's something to be aware of. Despite these little quirks, Dr. Brandeis emphasizes that Cialis, or Tadalafil, is just as effective as Sildenafil and Vardenafil when it comes to treating ED. For guys who want to use it as needed, the typical starting dose is 10 milligrams, with the option to bump it up to 20 milligrams if needed. And of course, there are those lower daily doses we talked about, the 2.5 or 5 milligrams, if you're going for the continuous approach.
What really caught my eye was how Dr. Brandeis points out that daily Cialis can also be used to treat lower urinary tract symptoms, or LUTS, which are often associated with an enlarged prostate, which is also known as benign prostatic hypertrophy, or BPH.
That's a great point. It highlights how a medication can sometimes have multiple benefits.
So Dr. Brandeis explains that daily Tadalafil, it can relax the muscles in the prostate and bladder, which helps alleviate those pesky urinary symptoms. So for men who are dealing with both ED and LUTS, it's like killing two birds with one stone. You can address both issues with a single daily medication.
It streamlines things for sure, convenience and effectiveness.
Okay, moving on to Levitra, or Vardenafil. What are the key takeaways Dr. Brandeis highlights for this one?
Well, Levitra is known for being the fastest acting out of the original 3 PDE5 inhibitors. It often kicks in within 10 minutes for some guys.
10 minutes, wow.
Yeah, it's quick, its effects last for about 6 hours, and the maximum dose is 20 milligrams. In terms of side effects, it's generally similar to Viagra and Cialis.
He does mention this sublingual form of Vardenafil called Staxin.
Oh, right, Staxin. It's a tablet that you dissolve under your tongue, and the idea is that it gets absorbed into the bloodstream even faster than the regular tablets.
So even quicker onset of action.
Potentially, yeah.
All right, and bringing up the rear, we have Stendra, or Avanafil.
The new kid on the block.
Relatively speaking, yeah. It was approved in 2012.
Mm-hmm.
What makes Stendra stand out?
Well, according to Dr. Brandeis, it also boasts a rapid onset of action, often kicking in around 15 minutes for many men. Its effects last for about 8 hours. And maybe a big plus for some guys is that it seems to have a lower incidence of side effects compared to the earlier PDE5 inhibitors.
That's always a good thing.
Absolutely. And it comes in 2 doses. 100 milligrams and 200 milligrams.
So let's recap those general recommendations for PDE5 inhibitors that Dr. Brandeis lays out. They all work by boosting those cyclic GMP levels to help you get and maintain an erection when you're sexually stimulated.
Right.
Avanafil seems to be the quickest acting.
Mm.
And it's super important to remember that things like high-fat meals and alcohol, they can delay the absorption of Sildenafil and Vardenafil.
Yeah, that's something to keep in mind.
But food doesn't seem to affect Tadalafil and Avanafil as much. These are really important things for our listeners to know so they can make informed decisions about which medication might be right for them.
Absolutely. Understanding those little nuances can make a big difference in your experience.
And that brings us to the section where Dr. Brandeis talks about potential interactions. He emphasizes the importance of being aware of how these medications might interact with other drugs you might be taking.
Right.
And the first one he highlights is the interaction with alpha-blocking medications.
Which are commonly prescribed for BPH?
The enlarged prostate.
Right.
So Dr. Brandeis explains that taking PDE5 inhibitors along with alpha blockers, it could lead to a drop in blood pressure, which could be dangerous. He even lists some specific examples like doxazosin, terazosin, tamsulosin, and silodosin.
This is really critical information. If you're taking any of these medications, you need to talk to your doctor about it. Don't just assume everything's fine.
Definitely bring it up with your doctor. And he does mention that tamsulosin and silodosin, they seem to have a lower risk of causing those big blood pressure drops when taken with PDE5 inhibitors compared to some of the older alpha blockers. But still, it's a situation that needs careful management.
Right. Don't play doctor yourself. Get professional guidance.
And then there's a serious warning about nitrates.
Oh, yeah, this is a big one.
Dr. Brandeis, he's very clear. PEE5 inhibitors should never be taken with nitrates in any form, whether it's those little nitroglycerin tablets that you put under your tongue for angina or any other medication that contains nitrates.
It's just too risky. Both PDE5 inhibitors and nitrates, they work by widening your blood vessels. So taking them together can cause your blood pressure to plummet dangerously low. It can be life-threatening.
So folks, listen up. This is not something to mess around with. Dr. Brandeis even gives a specific waiting period, 24 to 48 hours, depending on which PDE5 inhibitor you've taken, before it's safe to use nitrates. So be smart, be safe.
Absolutely. Better to be safe than sorry. And we talked about grapefruit juice earlier, but Dr. Brandeis also broadens the discussion to include other PDE5 inhibitors, suggesting that in general, it's wise to be cautious with grapefruit juice if you're taking any of these medications.
Good general advice.
Because it can affect how those drugs are metabolized in your body.
And speaking of things to watch out for, Dr. Brandeis provides a really helpful rundown of the common side effects you might experience with PDE5 inhibitors.
Yeah, he covers all the bases.
So the most commonly reported ones, he says, are nasal congestion, facial flushing, headaches, back pain, and acid reflux. And then he mentions that a small percentage of guys, around 3%, might experience temporary changes in their vision, often described as a bluish haze.
I've heard of that one.
It's thought to be due to a little interaction with a related enzyme called PDE6. And the good news is it usually goes away on its own within a couple of hours.
Yeah, it's temporary.
Now, he does address this rare but serious side effect called non-arteritic anterior ischemic optic neuropathy, or NAION for short. It's a mouthful.
Yeah, definitely easier to just say NAION.
He provides a statistic. It's 23 reported cases over a period of 7 years, and during that time, millions of doses of PDE5 inhibitors were taken. So it puts the rarity into perspective.
It does. It's good to be aware of it, but it's also important not to get overly alarmed.
And he mentioned some extremely rare reports of effects on hearing, too.
Right. Again, it's about being informed and aware. And as Dr. Brandeis emphasizes, while Viagra's main action is in the penis, it can affect blood vessels throughout your body, which explains some of these less common side effects.
So that was a deep dive into Viagra and its cousins. But Dr. Brandeis doesn't stop there. He takes us beyond these well-known meds to explore other promising options for enhancing sexual function. And one of those is oxytocin, often referred to as the love hormone. So what role does it play in men's sexual health?
Well, Dr. Brandeis describes oxytocin as this fascinating peptide hormone that plays a big role in sexual behavior, orgasm, and those feelings of bonding that happen during sexual activity. And it does that in both men and women. But he notes that its primary role might be slightly different between the sexes. In men, it seems to be especially involved in strengthening that sense of connection with your partner during intercourse.
And the book suggests that taking oxytocin as a supplement could actually boost sexual satisfaction for men.
That's what some studies are indicating.
Interesting.
Yeah, it's pretty fascinating. Some studies have shown that supplementing with oxytocin can lead to those increased feelings of intimacy with your partner and even intensify the feeling of orgasm. There's even a case study he mentions in the book where it helped a guy who'd lost the ability to orgasm regain that function.
Wow, that's pretty amazing. So how is oxytocin typically administered? I know there are a couple of different ways.
Right. So the most common and generally the fastest way to take it is through an intranasal spray up the nose.
Okay.
Dr. Brandeis says that plasma levels of oxytocin can rise within about 20 minutes, and a lot of guys report feeling the effects pretty quickly, often within minutes. It has a relatively short half-life in your body, but the effects can linger for about an hour.
Okay.
Another method he mentions is oral drops that you put under your tongue sublingually.
Mm-hmm.
Some guys prefer this method, and the typical recommendation is to take about 4 drops around 10 to 20 minutes before you're planning to get busy.
What about side effects? Any potential concerns with oxytocin supplementation?
Well, the interesting thing is that the studies that have looked at intranasal oxytocin specifically for men's sexual health, they haven't reported any significant or common side effects.
So it seems pretty safe.
So far, yeah. But there have been some minor side effects reported in studies on women who are using oxytocin for other medical reasons. Things like a stuffy nose, mild allergic reactions, or headaches.
Okay, nothing too serious.
Right. But Dr. Brandeis does have one important caution. He says that if you have a history of psychosis, you should not use oxytocin because it can affect your central nervous system. He also emphasizes that because oxytocin has such widespread effects in the body, it's really important to use it only under the guidance of a healthcare professional.
That's good advice for any kind of supplement or medication, really.
Definitely. And he mentions that research is ongoing to explore the potential of oxytocin as a valuable tool in men's sexual medicine.
So more to come on that front.
Mm-hmm.
Now, another interesting option Dr. Brandeis dives into is apomorphine. And this one works in a totally different way than the PDE5 inhibitors and oxytocin.
Totally different pathway.
So how does it work?
Well, Dr. Brandeis describes apomorphine as a dopamine receptor activator. It works in your brain.
In the brain.
Yeah, it's not working directly on the blood vessels in the penis like the PDE5 inhibitors. By stimulating these dopamine 2 receptors, it directly activates the nerves that trigger an erection. So it's a neurological approach.
Interesting. And I remember reading that even though it's derived from morphine, it doesn't have any opiate activity and won't show up on standard drug tests for opiates.
Right. It's not an opiate.
Which is probably reassuring for some guys.
Yeah.
And I think it's mainly used for Parkinson's disease. But Dr. Brandeis says that at lower doses, it can be effective for stimulating erections with minimal side effects.
That's the key, finding that sweet spot with the dosage. And they figured out a good way to deliver it, too. There are sublingual tablets now, so you just dissolve it under your tongue.
Makes sense.
And it gets absorbed pretty quickly, usually within 7 minutes. Most guys report feeling the effects within about 20 minutes, though occasionally it can take a bit longer, up to 50 minutes. And the effects can last for several hours, but the recommendation is to stick to just 1 tablet every 8 hours.
So don't overdo it.
Right. And it's interesting to note that there have been studies on women using apomorphine for issues like low sexual arousal and dysfunction, and they've shown some promising results with increased sexual satisfaction scores.
Oh, wow. So it has potential applications for both men and women.
It does, yeah. And in terms of side effects for men, they're generally not common at those lower doses used for erectile function, but some guys might experience nausea, vomiting, headaches, or dizziness.
So generally well tolerated.
Yeah, for most people. Now, here's where Dr. Brandeis really gets into the nitty-gritty of how apomorphine compares to something like Viagra in terms of its mechanism of action.
Okay, break it down for us.
All right. So with Viagra and the other PDE5 inhibitors, they're working locally in the penis to relax those smooth muscles and increase blood flow. But apomorphine, it takes a different route. It works centrally in your brain. It stimulates those nerves that then influence the oxytocin-activated nerves in your spinal cord, which ultimately leads to that same end result: smooth muscle relaxation and increased blood flow to the penis. So different paths, same destination.
So Viagra acts directly on the blood vessels, whereas apomorphine works through the nervous system.
Exactly.
And then there's PT-141, also known as bremelanotide. Dr. Brandeis points out that it's FDA approved for hypoactive sexual desire disorder in women, but in men, it's still considered experimental for boosting both erections and libido.
Right. Still in the experimental phase for men.
But the research seems promising.
It does. Dr. Brandeis mentions that studies have shown good results in both areas, and there are two main ways it's being studied for delivery: subcutaneous injection and intranasal spray.
So like an injection under the skin.
Right. And it's similar to how you'd give yourself an insulin shot, just under the skin. He says that it typically takes 30 to 60 minutes for an erection to develop after the injection, and the effects can last for 1 to 2 hours.
Okay.
And he recommends injecting it at least 45 minutes before you anticipate any sexual activity. Now, here's the interesting part. He also mentions that the increase in libido, that can also happen within that same time frame, and it might even last longer, like 1 to 2 days.
Interesting. So it could have both short-term and longer-term effects on desire.
Potentially, yeah. And with the intranasal administration, Dr. Brandeis cites a study where a 20 milligram dose led to an erection in most men after about 30 minutes, and the effects lasted for about an hour. And the study found that those single doses were generally safe and well tolerated.
So that's good to know. And what about the way bremelanotide works? It's different from the others too, right?
Yeah, it's got its own unique mechanism. It activates these melanocortin receptors in your brain, which have direct connections to the nerves that go to your penis. And by activating those receptors, it triggers both an erection and sexual arousal.
So it's working on multiple levels.
It is, yeah. But there are some cautions with bremelanotide, especially when it comes to how often you use it.
Yeah, what's the deal with that?
Well, Dr. Brandeis stresses the importance of limiting the injections to no more than 1 every 24 hours and a maximum of 8 injections per month. And the most common side effect is nausea.
Not fun.
No, not fun at all. But he mentions that it can often be managed with over-the-counter remedies like Pepcid or even a prescription medication like Zofran if it's really bad. Other common side effects include things like vomiting, hot flashes or flushing, cough, stuffy nose, headaches, tiredness, dizziness, and then some guys experience some local reactions at the injection site like pain, bruising, redness, itching, bleeding, numbness, or tingling.
So a range of possibilities.
Right. And he mentions a rare but potentially noticeable side effect: darkening of the mucous membranes or skin in some people.
Okay, good to be aware of that. And finally, Dr. Brandeis wraps up the chapter with a discussion of natural nitric oxide boosters. And this section starts with a really personal touch. He talks about his own professor, Dr. Louis Gennaro, who won the Nobel Prize for his groundbreaking research on nitric oxide.
It's a nice way to bring it full circle.
It is.
Yeah.
And it highlights how these fundamental discoveries in science can have such a profound impact on our lives.
Absolutely.
So for our listeners who might not be familiar with nitric oxide, how does it work in the context of erections?
Okay, so here's the deal. When those nerve impulses, those signals, reach the end of the nerves in your penis, they release nitric oxide onto the smooth muscle cells in the walls of the arteries.
Right.
And this triggers a chemical reaction that leads to the production of, you guessed it, cyclic GMP.
There it is again.
It's the key player. And remember, that increase in cyclic GMP, it causes the smooth muscles to relax, which widens those blood vessels, allowing for more blood flow to rush in, which is exactly what you need for an erection.
So nitric oxide is like the conductor of the erection orchestra.
I like that analogy. It sets the whole process in motion.
And Dr. Brandeis talks about how, as we age, our natural production of nitric oxide can decline, which has implications not just for erectile function, but for other aspects of our health, too.
Yeah, it's not just about sex.
So what are some of the things that can happen when our nitric oxide levels drop?
Well, Dr. Brandeis says that nitric oxide production can naturally decline by about 10% per decade, starting as early as your 20s. So by the time you hit your 50s, your levels could be significantly lower. And that can contribute not only to a decline in erectile function, but also things like reduced athletic performance and even some decline in short-term memory.
Wow, it's involved in a lot of important functions.
It really is. It's kind of like the unsung hero of your body. And when it comes to sex, having sufficient levels of nitric oxide and cyclic GMP is crucial for healthy sexual intimacy.
So what can we do to boost our nitric oxide levels naturally?
Well, Dr. Brandeis outlines two main dietary pathways, and this is really practical advice that everyone can benefit from.
Yeah, let's hear it.
So the first one involves eating foods that are rich in an amino acid called L-citrulline.
Okay.
And some good sources of L-citrulline are watermelon, beans, nuts, meat, and leafy green vegetables.
So lots of delicious options.
Exactly. You don't have to choke down some weird supplements to get the benefits. And in your body, L-citrulline gets converted to L-arginine, which then combines with oxygen to produce nitric oxide.
Okay, so it's like a chain reaction.
Right. Now, the second pathway involves eating foods that are rich in nitrates. And good sources of nitrates include things like salad greens and beets. Beets, yeah, they're a powerhouse. And here's how it works. Dietary nitrate gets converted to nitrite by the saliva in your mouth, and then it gets further converted to nitric oxide in your stomach.
Interesting. So it's a two-step process.
Yeah.
Now, it's important for our listeners to understand that these natural nitric oxide boosters are different from the nitroglycerin tablets that we talked about earlier, which you should never take with PDE5 inhibitors.
Right. Very important distinction.
Dr. Brandeis really emphasizes that. So what's the difference?
Well, those nitroglycerin tablets that people take for chest pain, they work very quickly. They rapidly convert to nitric oxide to relax those blood vessels and reduce that chest pain. But those swallowed nitric oxide boosting supplements, they work much more slowly and have a less intense effect on your overall nitric oxide levels.
So it's a gentler, more gradual increase.
Exactly. And Dr. Brandeis even mentions that some oral slow-release nitric oxide boosters, like his own supplement, Affirm, can be taken safely alongside PDE5 inhibitors. But again, always talk to your doctor first to make sure it's right for you.
Always good advice.
Always.
Now, I remember reading about some really interesting research on the benefits of nitric oxide supplementation beyond just erectile function.
Oh, yeah. There's a growing body of evidence showing that nitric oxide can have some pretty impressive effects.
What are some of the highlights?
Well, Dr. Brandeis mentions a study from Vanderbilt University that showed just a single dose of a nitric oxide supplement reduced systolic blood pressure by 4 millimeters of mercury and diastolic blood pressure by 5 millimeters of mercury, and that happened within 20 minutes.
Wow, that's pretty impressive.
It is. And there was another study done at Baylor University with weightlifters.
Okay.
The guys who are taking nitric oxide boosters, they increased their bench press max by 13 pounds more than the control group over 8 weeks.
So they got stronger.
Significantly stronger. And then there was a study with cyclists, and the participants who were taking a nitric oxide boosting supplement, they improved their track times by roughly 1.5% in just 1 week, and they reported less muscle fatigue.
So better performance and faster recovery.
Exactly. And Dr. Brandeis also talks about his own nitric oxide supplement, Affirm, which is formulated to utilize both of those nitric oxide pathways we talked about earlier, the L-citrulline pathway and the nitrate pathway. He says that a lot of his patients have reported improvements not just in their erectile function, but also in their short-term memory and athletic performance. And in some cases, he's even been able to help his patients reduce or even discontinue their blood pressure medications under careful medical supervision, of course.
That's really remarkable. So it sounds like increasing your nitric oxide levels can have some pretty far-reaching benefits.
It really can. And at the end of the chapter, Dr. Brandeis provides some helpful website resources for listeners who want to delve deeper.
Yeah, what are those?
He mentions www.BrandeisMD.com and AFFRMscience.com.
Excellent. Well, Dr. Brandeis has really outdone himself with this chapter. It's packed with information, but it's presented in a way that's easy to understand and, dare I say, even entertaining.
He's a great writer.
He is. Viagra and Beyond is a fantastic chapter in the 21st Century Man, And we highly encourage you, our listeners, to pick up a copy of the book and check it out for yourself.
It's worth it. It's full of valuable insights.
And don't forget to explore the other chapters, too. It's an amazing resource for understanding the modern male experience.
Absolutely. There's something in there for every guy.
Well, that was an incredible journey through the world of Viagra and beyond. We hope this deep dive has given you a better understanding of the science behind these treatments, the options that are available, and the potential benefits of boosting your nitric oxide levels naturally. And who knows, maybe we've even sparked some interesting dinner table conversations.
Maybe.
Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.